I want to thank all of you for coming and participating in this event because I think we all have a common and unified commitment to making health insurance reform work in the state of Washington and seeing just exactly what we can do. And there's really two parts of it. One part of it being what we do here at the state level, and the other part of it, of course, being what's happening at the national level. I had that recent opportunity here to go and testify before Congress, and I think there's a ready acknowledgement on the part of all of us that have been following it very closely, just how difficult and challenging healthcare reform represents. Yes, there's even a few of us that willingly acknowledge that it's a lot more challenging than it might have appeared. We clearly are in a position right now to see what can be done at a national level. At least I believe that there's reason for hope at this point going forward and looking for a bipartisan solution, not the least of which is because of the recent attempts by Congress that left the field bare, and the real challenges are what can we wind up doing to stabilize the health insurance market, both from the standpoint of the state, but more importantly for this discussion that I wound up having last week, what we can do at the national level. So last week I was a guest along with 4 other insurance commissioners from around the country to kick off the panel for a discussion before the HELP Committee, Health, Education, Labor, and Pensions, chaired by Senator Lamar Alexander and Ranking Member, our own Patty Murray. It was an opportunity to lay out what we as insurance commissioners are experiencing, and the other states are ones that have diverse experiences. On the panel with me were Alaska and Oklahoma. Both states have 1332 waivers in right now. I think both of them have been approved now, along with Tennessee and with Pennsylvania. What I returned to home really feeling much better, really feeling encouraged after that experience. And it's not just because I sat there for 3 hours with no break before the committee. There was an hour and a half before, which was kind of more like a coffee that was set up by chaired by both Murray and Alexander, and they sat at the head table with us as insurance commissioners with over 30 United States senators. No press, no staff. Senator Alexander made it very clear, if anybody starts giving a speech as a senator, I'm going to interrupt you because this is where you can ask questions. It isn't where we want to pontificate on the issues that we have before us. It was an opportunity for them to really share on a much more visceral level their perceptions, recommendations from the standpoint of testing those recommendations as to whether they would be viable or not. One of the things that I found particularly interesting is to have that kind of give and take with United States senators asking questions as they would direct it to one commissioner or another, or would leave the field clear enough so that I didn't hesitate to jump in. I should point out that of those other 4 states, not one of them established their own health insurance exchange, and not one of them right out of the blocks denied the legacy or grandfathered policies from continuing, which had a negative impact on the risk pool that was created by virtue of the Affordable Care Act. So we were in the state of Washington, that is, in a very different position. So now we're really focusing on what we can wind up doing to stabilize the market. Even though we have the diversity of insurance commissioners coming from other states, it's important to point out that we were unified in our message. When we talked about cost-saving reduction, CSRs. We were united that that was the number one issue that needed to be addressed by the Congress. We have to get past the experience that we've had with President Trump creating a high degree of uncertainty in the market and threatening to eliminate that funding on a monthly basis. We have to have some predictability. The National Association of Insurance Commissioners asked that that funding be made permanent. Realistically, that was, let's say, our initial offer, because I don't think it's going to wind up being permanent, but at the same time, it was an indication that that kind of certainty in the market was absolutely critical. The insurance industry, I think we all know, has been somewhat spooked by this administration, initially by the attempts to repeal and replace, and then, of course, by the uncertainty of the CSRs as to whether they will continue or not. And I need to point out that I was reading in, I can't remember if it was Politico or otherwise, or another publication just yesterday, that there's still some senators that are going around talking about CSRs being a bailout for the insurance companies. It's a bailout for those individuals who are low income and their out-of-pocket expenses for copays and deductibles. It certainly doesn't afford the insurance companies any relief, except to help establish a much broader risk pool that is going to have good risk and bad risk in it if you have CSRs that are being offered. So I think that number one is that and Senator Alexander made this clear actually the day after I was there testifying, which was last Wednesday, that he said any proposal that comes forward will include funding for the CSRs, and he also indicated that a great deal of it had quite a discussion also, in addition to talking about CSRs, as to what might happen with Section 1332 waivers of the Affordable Care Act. Waivers would allow states to take on new approaches as to how they run their health insurance reform in their state. Senator Alexander, kind of pushing back a bit, said, well, we're not going to be a deep pocket, so we start putting more money through the CSR, through the 1332 waiver process, put more money into the states. I said, Senator, I'm not asking for the state of Washington for more money. I just want more certainty going forward. If you can speed up the process for waiver approval or evaluation so we know it's either thumbs up or thumbs down, that would be a huge benefit to us as a state. So rather than 6 months, if you can get it down to 2 or less months, that would have a very positive impact for us as we take a look at 1332 and see if there's any opportunity for the state of Washington. One of the issues that came up with 1332 is the concern that a number of us have about removing the guardrails, the out-of-pocket, it should be the limitations on total spending, and in addition to that, the essential health benefits. That is a particular concern to me personally, because I see those consumer protections as being paramount as a part of the Affordable Care Act. At the same time, to move away from there would be to essentially invite going back to what we had before the Affordable Care Act. So a real question will be, since Senator Alexander talked a great deal about 1332 and changing that process, what kind of changes are being contemplated? And I think that'll be particularly interesting to make sure that they're not reducing consumer benefits as a result of the proposals that come forward, and such as repealing the guardrails, and which obviously would have a very detrimental effect from many of our perspectives. I think that is going to be perhaps one of the more challenging parts right now and going forward, it will be the interesting outcome of seeing whether Senator Murray can sign on to what Senator Alexander puts together. If that's the case, and I think they have the capacity clearly to be able to do that on a proposal, it'll be fairly narrow. It's going to focus much more on CSRs, probably 2 years being most likely the number that's going to be talked about. There will be provision or language in there for 1332. I can very confidently say that Senator Murray also has deep reservations about preserving the guardrails of the ACA with essential health benefits and limitations on total spending, and she doesn't want to see that eroded. So it'll be interesting to see if they can reach that agreement. I think they can do it, and I think there's a willingness to do it. I think the real question right now is if they come to that agreement, and I anticipate that it's most likely to be something we will see at the first part of next week, based on what Senator Alexander said actually in private conversation after the hearing. So it'll be interesting to see just exactly if that materializes at that time. And if it does, the question will be, can Leader Mitch McConnell, will he have the ability to bring it to the floor for a vote? He's going to face some very strong, presumably, opposition if this is a Murray-Alexander proposal, strong opposition from the hardcore conservatives in the United States Senate, and whether that kind of internal friction is something that he feels strong enough to push on, because if it winds up going forward, it would be one where Senate moderates and Democrats would wind up then being the ones that wind up seeing the legislation actually pass. One of the things to note about the impact of particularly looking at what we've seen right now with the federal reinsurance program is, and by the way, they need to get this done by September 27th, which is kind of the drop-dead date for most carriers to indicate whether they're going to participate in the 2018 market. So it's a very narrow window here that's afforded to them. Now, on the issue of the federal reinsurance program, I sense from what I'm seeing right now and hearing the discussion that there's a lot of support for it, but it's not like something they're trying to get into a place for. In the case of CSRs, it's trying to impact what's happening in 2017, but also then 2018. That the federal reinsurance program, if it were to a transition program that existed for the first 3 years in 14, 15, and 16, whether that comes back for 2019 or not will be party to a later debate. And I saw there was a considerable amount of interest in that topic from the standpoint of being bipartisan about having some restoration of reinsurance, but not in the proposal that will be before us here shortly. So I don't anticipate seeing it be part of the proposal that comes forward with Alexander and Murray here now. I would like to make the argument, though, that as a state, we can't wait for the feds to act on this. We need to take a look and see what we can do as the state of Washington going forward. Market stability is something that is paramount for us in 2019. I certainly had a wake-up call when we had 2 counties out of our 39 that did not have individual market insurers in them, much less individuals participating in the exchange. And that was a wake-up call for 2018. Thanks to our issuers, that's been covered now. But what happens in 2019? I have a major concern about rural communities. We have 9 counties in the state of Washington with only 1 insurer. They're all rural counties. Rural counties have always been tough. It predates the Affordable Care Act, but I'd certainly like to see that as we go forward and look towards stability, that we're focused not insignificant amount of our energy on the question of what we can do to make sure those rural counties aren't left without opportunities. We're working very closely with the Health Insurance Exchange as a full partner going forward. We're working with the health insurers, the providers, legislators, and certainly advocates in the healthcare community. Now, Molly Nolet's going to talk a little bit more about this in a little bit on a different panel, so I don't want to try to get ahead of her on this, but let me just touch on a couple of the key points that we will be looking at. One issue that we've done already is to collect confidential data from the issuers. We did that by virtue of legislation that passed at the end of this last legislative session. So we have collected that data, and we've also retained a consultant, Wakely, that is working closely with us going forward. And we're going to certainly use those findings to determine what actions that we can wind up doing as a state. Such things as creating a state reinsurance program that would be different from the feds, what we can do there, what our opportunities exist. We're also looking at what could be part of state offering of health insurance or a public option, with a particular interest in what it looks like out in some of those rural counties that we need to make sure that we keep covered, and addressing the issues around geographic rating areas in the state of Washington. Are there some things that we can wind up doing there that help to guarantee those rural counties aren't left high and dry? I want to emphasize that nothing is predetermined. Everything is before us at this point. This is when we want to run a very transparent process. We want to, by mid-October, have a report available and available to the public to view and analyze. So we're going to be sharing it very broadly, and again, by mid-October. If you want to track what we're doing and how we're doing it, I'd urge you to go to our website, again, being as transparent as we can, and you'll get the most up-to-date information as to the efforts that the exchange and the insurance commissioner's office are engaged in right now to see if we can bring about a great deal more solidity in the market so it isn't as fragile as we see it today. Last week, I had an interview with the Seattle Times, and it was with the idea of doing an editorial. They haven't done the editorial, but afterwards, that same editorial writer called our office and was talking to one of my staff members and said, Kreidler always sounds so optimistic. I plead guilty to that charge. I really believe very strongly that we have a great opportunity here, and I'm hopeful that Congress will rise to the occasion and help make sure that we don't destabilize the Affordable Care Act. The law has been and is working well in the state of Washington, particularly when you hear the horror stories of what's happening in other states, almost invariably, if not invariably, because they didn't fully engage the Affordable Care Act and tied one hand behind their back, and then wonder why they have a tough time keeping their health insurance in their states alive and well. I'd be the first to say, and I've said it many times, that the Affordable Care Act certainly isn't perfect. But what we need to do at this point is focus on those issues where we can correct those ills and make them work better for the people of our state. And I can't emphasize enough, and I did when I was before the Help Committee last week, the individual market is in serious trouble nationally. And we're doing better than almost any other state, but that doesn't mean it's perfect. Every time we have actions either by the Congress or by the President, they obviously are, that can be interpreted as destabilizing. That is certainly not helpful for us maintaining the integrity of the individual health insurance market in our respective states. Yes, it represents something like 6% of the total market nationally. At the same time, it really is the canary in the mine. And when the individual market gets sick, we're talking about people who pay their own premiums, they don't receive subsidies. These are people very close to and needing health insurance, and the vitality of that market is critical for all of us. That's, and it certainly requires some hard work on the part of all of us. I've had the opportunity to testify several times over the last couple of years with the passage of the Affordable Care Act to speak before congressional committees, and I'm going to continue to do that where the opportunity comes along. We've got to do everything we possibly can to stabilize the health insurance market going forward. We have a great opportunity right now to make things better nationally and here in the state of Washington. But it's a shared commitment that I certainly feel very keenly when I have an opportunity to be before a group like all of you, because we share that very much in common. And I very much look forward to working with each and every one of you going forward to make sure we fulfill that ambition and that dream for the people of our good state. Thank you.
Commissioner, thank you very much. I appreciate it. Aaron, you want to come? Why don't you and I have a seat here?
Okay.
And you can pick either side. That's great that you picked that side because, I'm losing all my hair, and I think I look a little like I have more hair if I'm on that side. You got that one? Great.
You think
Thank
I have
Aaron.
more?
No. If I sit this way, there's nothing more humbling than looking at yourself on a widescreen TV, right?
Yeah, true.
So if I sit this way, I feel a little more confident. Thank you. Is the commercial insurance market more stable today, in your opinion, than it was last year at this time, or less stable?
Oh, it's definitely less stable. I was feeling very optimistic a year ago about where we were at. Now, we'd seen some significant rate increases for 2006 or 2017. 8 to 10% of that was attributable to the transition reinsurance program going away.
Yeah.
So that was the major driver for why we'd seen a rate increase. But I was getting much more confident, one, about how the issuers were viewing the individual market, and also about whether they were going to be able to look at the bottom line and say, yeah, we're not still losing money,
Right.
Which I think would have made a big difference. Today, I don't think that's the case because of all of the destabilization. We've seen some issuers retract from our individual market rather considerably. We're also seeing some fairly significant rate increase requests, and I think all of that can be attributable back to what's happening at the national level.
There's been a tremendous amount of buzz since really 2014 around the individual market, which has been historically a problematic market in Washington State in particular. How do you view the small group market? Do you think that has gotten stronger as a result of the subsidies flowing through into the individual market, or do you think that the small group market is precarious also?
Well, we have a somewhat unique situation in the state of Washington because of the existence of all of these associations that are out there that are marketing health insurance, some better than others. If these associations were ones that treated all of their members equally, were transparent about the rates that they're charging, that would be a much better scenario. Unfortunately, that's not the case.
Yeah.
A number of them are creaming the market. If they have a small employer that winds up having some sick people, they could face a very significant rate increase, which is a way of saying, go buy your health insurance someplace else. We don't want you any longer.
And these association health plans, there are a lot of defenders of association health plans, but they run the gamut. On the one hand, you've got master builders, historically a little more conservative, Republican or leaning organization. You've got the Association of Washington Cities, public employees, they have an association health plan as well. You went to court over this issue, or there have been a series of lawsuits, rather, on this issue. Is the association health plan issue put to bed and now established settled law? Or do you think that there should be maybe ongoing legislation or future litigation? How do you see that issue?
I don't think that's one where we know the final, whether the final bell on that is rung now or not. I mean, we have action against an association here, centered here in Spokane right now, that by the U.S. Department of Labor, that found some practices that were highly suspect. And I think that may be attributable to some of the other associations. So I wouldn't be surprised to see it being something out there that will continue to be a challenge for us. And I think, as long as we don't have health underwriting, but that health underwriting so they can shed people who are sick and make sure they only insure the people that are healthy, are going to really be a very much of a disruptive factor for the small group market. And that's something that I'm certainly very interested in seeing if we can get past. Most associations do a fine job. It's those that don't, and do so to the detriment of even their members, but the members don't have the information to know that they're getting a bad deal. We want to make sure that that is something that's much more transparent, and that they aren't using medical underwriting to deteriorate the market.
I can understand the certainly there are clear divisions in the employer space between ERISA self-funded plans and other large group plans. That's pretty clear, both in terms of business logic and statutory regulation. It's relatively clear to, I think, a lesser degree why there's a separation between large group and small group, but I think that makes sense. What do you think about this division between the individual market and the small group market? Should those two markets be blended together and merged into one risk pool?
DJ, I think the number one issue we have right now is stabilizing the market for the individual market. I mean, that is so much the center right now. I think there's some other opportunities out there that we can do. And in a different world, if elections had gone differently, I think I'd have wound up making some proposals to the legislature, because I think we'd have been ready for it. Right now, we just want to make sure what is happening in other states and what potentially could happen here that could really take us back to the late 1990s when we saw the individual market collapse in the state of Washington. We could see that replicated on a national level. That's our principal focus, both for the state of Washington and really nationally.
So it's sort of a defensive game in health policy in Washington state.
I think we need one. I think the debate over the Affordable Care Act was number one, and then there were the repeal and replace before us. I think we hopefully have gotten past that, but we certainly know that Graham Casey's proposal is still out there fluttering weekly, but it's still there. That obviously makes me rather nervous, but at this point in time, I'm certainly listening to Senator Alexander and having the opportunity to have discourse with a number of senators, almost half of the United States senator at one time or another, either before the committee or in the coffee that we had before, participated. That I feel fairly optimistic that we could see a breakthrough.
Let me ask about this sort of, I think, backlash on the left to what has been taking place in recent years. This sort of increasing enthusiasm around some sort of single-payer policy. Nobody knows what that means. It means different things to different people, but it's this sort of idea that Bernie Sanders announces this morning in terms of his bill. California has a bill that would move that forward. The price tag in California is larger than California state government, but nevertheless, they have legislation moving forward. What do you make of that sort of backlash? I mean, it used to be that as a Democrat, you had to kind of say you were against single payer in order to be accepted by the mainstream or a more centrist group, and now it seems like it's shaping up to be kind of a pillar of a future Democratic primary, that you have to be supportive of it.
Well, I think at one point you looked at the Affordable Care Act and said, hey, this is a product of the Heritage Foundation's recommendations. This is a conservative Republican proposal. And in '93, there was the the proposal by Senate Republicans, Dole Chafee, that was actually incorporated exactly what we have in the Affordable Care Act, and you had 20 Republican United States senators as co-sponsors of that measure. So I think there was a certain belief on the part of many Democrats that they were already there with this. And I think it also represented why you had negative numbers for the Affordable Care Act as long as you did. I mean, the one thing repeal and replace has improved the standing of the Affordable Care Act rather considerably. It's moved into the mid-50s now, twice as high as any of the replacements that were being proposed at the federal level. So I think there's now kind of maybe a little bit more coalescing there was when repeal and replace was being debated. I think long term, I think that one of the real challenges that we have is that if you destabilize the health insurance market, which is why we're talking stabilization right now, I think very likely the alternative will be to come back with a single-payer approach. But what a single-payer approach are we talking about? Senator Conyers' proposal is pretty broad. I don't know what's going to be in the proposal that Senator Sanders is introducing today. But in any case, there are a lot of variations on a single-payer and how it works. Multiple choices that you make. It's not a simple yes or no. It's much more complex than that.
I want to open up to your questions also. We've got a couple volunteers with wireless mics, so if you want to ask Commissioner Kreidler a question, just flag them down. They're sort of at the corners of the room here, and then I'll see them and call on you. I asked about migrating or merging the individual and small group together. Nevada had a very interesting bill that would allow people to buy into Medicaid. Ostensibly, that would probably be folks at the lower end of the spectrum, those that are often in the individual market themselves. What do you think about sort of the other approach of essentially, I'll say this, it's not quite accurate to say it, but I'll say merging the individual and the Medicaid market. In other words, allowing maybe the subsidies that go to support an individual premium, allow those to be used to purchase a Medicaid product. Do you think that would be a way to stabilize the individual market?
I don't know if it would help to necessarily stabilize the market. I think we've CSRs and maybe getting a reinsurance program out there and maybe making the waiver process be one that works not to the detriment of consumers, but more smoothly than it does right now. I think that's kind of the first tier that we're at right now. In time, I think that's one of those issues to come back and revisit. And you touched on it, and I think you were trying to egg me into saying it, and that was about merging the individual and small group market. I think you have to make the small group market healthy. You can't have the good risk going off because of adverse selection from the standpoint of getting rid of the sick people being as much of a factor in that small group market. But one of the ideals was that the risk pool would certainly be broadened if you merged the two together. There should be a great deal more in the way of similarities between the individual and small group if associations didn't have their thumb on the scale, so that it'd be easier to do that merger without saying that the individual market is a winner, the small group market is the loser, which would have been the case before the Affordable Care Act. But I think a lot of things have changed now because of guaranteed issue.
Let me ask a question about, since I don't see any hands up. Oh, right there, great. Sometimes you got to stand up for me, sir, and give us your name, rank, and serial number.
Peter Dunbar. Is this thing working?
Yes, sir.
Yeah. Peter Dunbar, I'm CEO of the Foundation for Healthcare Quality. We hear a lot about the risk about the market collapsing, and I remember the market collapsing back in the 90s, obviously by my age. But to what extent is it the market collapsing, or is it just that the overall costs are rising so fast and are so high? Is that the problem, or is it just an insurance mechanics issue?
I think one of the big mistakes, and that was one of my real concerns with some of the Republican proposals that were coming forward for replacement, were that they were in total denial of understanding insurance principles. You can't have guaranteed issue, remove the individual mandate, and think that that can work. We tried that. It didn't work really well. It took a couple of years, but we collapsed the market in the state of Washington. I think that's what really causes me the most concern, is that there are features of the Affordable Care Act that nobody wants to touch, but if they leave them in place without making other underlying changes, they'll erode the market to the point where it collapses.
Let's go over here for a question. Do we have is it turned on? We're not.
On?
There we
it is.
go.
Hi, good morning. I'm Susie Dade with the Washington Health Alliance. I have a different sort of question, and it really has to do with the really, I think, significant levels of consolidation we're seeing take place across the state. And I'm wondering if you might share your views about what impact that we're likely to watch that have on premiums in the state.
You know, in much the same way, thank you. In much the same way that we're talking about what could collapse, lead to a problem in the market to the point where we have a single payer, we could wind up seeing it as a result of the mergers and acquisitions that we're seeing both on the provider level and on the insurer level on a national basis. And I think that kind of consolidation, I mean, it's one thing to say that we're doing it for economic efficiencies of the market. It's another one where it becomes a sledgehammer to make sure that we're paid more as providers, or we put the gun to the head of the providers and say, you've got to sign this contract or you're going to go out of business. And I think that's one of the real threats that we have right now relative to mergers and acquisitions, whether it's on provider level or whether it's on the insurer level. That's a real concern to me. And I think that's one where we'll continue in my office to have discussions about this. We have discussions with the governor's office, and I think even on a national basis, these are themes that still keep coming up. And I think that's for some who are really opposed to a single payer, it's one for them to pay attention to. At some point they cross the line and it's not going to be feasible to continue to operate the system with as few participants as might evolve from all continued mergers.
I see a question right up here.
Morning, I'm Mike Maples. I'm a CEO of a health center in central Washington state. You identified that the CSRs are the #1 issue, and no argument there, but will it be enough? Because at the end of the day, the exchange markets are still going to be a numbers game. And with the undermining of, by the Trump administration of marketing and enrollment and statements that they will not enforce the penalties in the law, are we going to be able to get the numbers to keep the thing healthy?
You know, I'm optimistic that with bringing about some permanency to CSRs, but more bigger picture, the Affordable Care Act, so it's not under constant assault. If you can get to that point, what I don't know right now is how important, I consider it important. In fact, it's interesting, the Dole Chafee bill in '93 actually had tougher financial penalties as part of the individual mandate than the Affordable Care Act does. And that was a Republican proposal. So I still see it being valuable, but if they wind up backing off on that, how much of an impact does it have in the entire market? I think a lot of it depends on whether we can kind of rise to the occasion so that we do more in the area of helping individuals to guarantee that if they're paying insurance premiums, they're going to be able to afford to be able to use their insurance, meaning the copays and deductibles are not going to be so much of a hindrance that they can't afford to use their own insurance. We've got to, particularly for those individuals who receive little financial support with CSRs or don't receive them at all and receive no premium assistance. So you've got to get kind of past that where we do more than what we're doing right now. But I personally think that if we can get where we stabilize with CSRs, and it's going to be there in permanency, but I think almost hand in hand, we've got to get to the point where there's an acknowledgement on a national basis that we got to stop this attack on the Affordable Care Act. Yes, let's see if we can make it work better, and let's see if we can do it on a bipartisan basis rather than the assaults we're going through right now.
I see a question back here also. Great, thanks for raising your hand.
Hi, I'm Sulani Madsen, and the relevant part of my background for this question is that I live in one of those rural counties. I was forced out of the insurance market in 2011, haven't had health insurance since. Self-employed, nothing, there's no affordable options. Our association health plan was impacted. So the question is, how come we can't buy insurance across county lines? Why don't we look at health care as the regional entity that it is in Eastern Washington? Where if you looked at Southeast Washington, and you've got Asotin and Columbia and Garfield counties, all very small, but they all have connections between them. And then it's more complicated than that because the healthcare delivery is not by county. The healthcare delivery is by specific regional geographic markets. And the same thing around Spokane. There are people in the counties surrounding Spokane who get their healthcare in Spokane or would prefer to. Why are we limited to buying insurance county by county? I mean, across state lines would be a whole nother step, but why can't we solve the county by county barrier?
That is part of the stabilization review that we're heavily engaged in right now, is to take a look at the geographic rating areas, which effectively would be the counties, as to how we might want to see them aligned in such a way so that the carriers in one of those, they're in all of those, so that the rating is established on a geographic area. We want to see if that's something we can wind up doing successfully for the very reasons that you're describing. Part of this came about because of the discussions that I was engaged in when I realized there were two bare counties, and particularly in my discussions with Primera and Grace Harbor County. Grace Harbor County has some very unique challenges, both from the standpoint of the level of health of their community, but also the nature of the provider community within that county. What can we wind up doing? And one of the issues that Primera raised, and they did agree to come back into Grace Harbor County, and that is, we're not proceeding to come out of Grace Harbor County, that was what is there some alignment here that we can do relative to geographic rating areas so that it could have a more positive impact, particularly for a county like Grace Harbor, but the other Grace Harbors around the state.
We're getting short on time. We're over a little bit, but when you look back at your time, I want to sort of conclude with this softball. They're all softballs for me, as you know.
Of course.
This is a softball. When you look back at your career as an insurance commissioner, but also legislator, member of Congress, you worked in the Clinton administration for a time, what do you think you're most proud of as you look back and reflect on your policy and political career?
Well, DJ, nothing will have made as much of an impression on me as taking on the implementation of the Affordable Care Act, without question. I mean, all of us that understood healthcare reform understood instantaneously it was going to be a very difficult task going forward, and it was a challenge. I think being able to successfully play a positive role for that implementation was a critical part for me.
Yeah.
And nothing that, as I look back at my professional career, could really rise to that occasion, because it's one thing to be a legislator, or an administrator in a large agency, but when you're the CEO of the insurance commissioner's office, and it is so much at the center of this storm, even more so than many other states, because the legislature gave a great deal more responsibility to the insurance commissioner's office than many other states enjoy, plus the fact I'm elected, so I can really play that very active role in trying to do that in the most positive way possible is still critically important to me.
Good. Insurance Commissioner for the state of Washington, Honorable Mike Kreidler, thank you very much for making time. Let's give him a round of applause. Thank you, sir. Appreciate it.